Long story short, online therapy can be fun and handy when you're trying to reach clients who otherwise would receive very little or no therapy services. However, it does behoove the speech language pathologist to be informed and to be responsible when it comes to online speech therapy services. I jotted down about 7 or 8 points I just want to touch on just to get you thinking about what you need to know before considering this type of service delivery model with your practice. First, technology. Be informed of the type of technology you're using to provide the service. Know the privacy, confidentiality, other safety parameters that are involved for your clients, and also ensure the quality of the session meets the standards of a same location visit so you can see and hear each other clearly during the speech therapy session. So again, client privacy and then quality of the session. Those are the two main things when it comes to technology. Next, your choice of clients. Online therapy may not be a good fit for everyone. Ideally, your client will be able to attend very well and focus on the task at hand, follow your instruction, sit up and stay still so their face can stay nicely within the camera range, and also benefit from this type of service. Ideally, there would be a caregiver or a contact person with the client, and that person may be able to use the computer keys or the mouse or arrange the camera if necessary, just an extra person to ensure that you're able to experience a quality therapy session. So again, strongly consider your choice of clients when you're trying online therapy services. Some clients need that same location visit regardless of time or distance restraints. Best fit for the client. Next, the type of intervention. When you're choosing online therapy service, make sure that you can do the proper type of therapy activities with that client. So again, the therapy activities available need to be a good fit for the client that you're seeing that day. So another consideration. And next, what about support personnel? For example, speech assistants. These assistants need to also be equally trained in using the technology effectively, and also any other strategies that will be valuable for them as they're trying to interact and train the clients through an online service delivery model. Always check with the regulatory body to ensure you know the guidelines for supervising the support personnel, or for having the support personnel provide therapy services, specifically when it comes to this online technology. Also, documentation, something else to consider. Will you be documenting online? And if so, how secure will that documentation be? If you're documenting in a hard copy chart, of course, again, just like you would online, maintain the standards of the regulatory body. Also, make sure you comment in there that you did provide the session through online therapy and that you did have informed consent from the client. You always want to keep best practices in mind when you are providing any type of therapy services, let alone something like online therapy services. And also, when it comes to documentation, why not document progress over time using this online service? We always need outcome measures. We always want to try evidence-based practice. So go ahead and document progress over time and client's reaction while you're at it. Next, licensure. Again, this relates to the regulatory bodies that help speech language pathologists serve our clients to the best of our abilities. So check with the state, provincial, or national bodies such as ASHA or CASLPA, and look under their telepractice guidelines or their code of ethics, and that will help you understand as well how to best serve clients using online therapy practices. Finally, make sure you know all about reimbursement. Sometimes you may or may not be able to be reimbursed through providing online therapy services. It just depends on where you live and how you usually receive that reimbursement. So check in for the reimbursement part too. I know that's a part of the job satisfaction. So, you know what? Enjoy this new technology. Enjoy your job, but most of all, enjoy your life.